Good afternoon and welcome to Consumer Voice's virtual Pep Rally webinar in opposition to proposed Medicaid cuts that are part of the American Health Care Act. I'm Robin Grant, Director of Public Policy and Advocacy at the National Consumer Voice for Quality Long-Term Care, or Consumer Voice for short. For those of you who may not be familiar with us, we're a nonprofit organization that advocates for quality care for consumers receiving long-term services and supports in any setting. So that includes at home and in the community, in assisted living, and within a nursing home. The purpose of today's Pep Rally is, first of all, to give you the latest information about what's going on regarding the American Health Care Act and Medicaid cuts. So that's the first purpose. Second, to equip you to contact your senators with a message opposing cuts. And finally, to energize you to make a call right away, right after this webinar, as part of National Call-In Day to Save Healthcare, which is today. So toward the end of our time together, we'll give you the opportunity to ask some questions, and then we're going to let you loose to hopefully flood DC with your calls. But before we start, let me cover just a few logistical details. Right now, all of your lines are muted, so everyone can hear without background noise. As I said, we'll take some questions at the end, but if you have a burning question prior to that and you want to ask it, you can do that by typing it in the question box, which should be on the side of your screen. And also, as you may have heard a moment ago, the webinar is being recorded, and we'll make both the webinar recording and our PowerPoint slides available after the webinar. So with that, let's get started with a quick update. So I'm sure that you all know that efforts have been underway in Congress since January to repeal the Affordable Care Act. So the work started on the House side, where representatives created a piece of legislation that's called the American Health Care Act. So the bill includes provisions that would fundamentally alter the Medicaid program and change how the federal government pays states. So right now, the payment system is based on people's needs. So the state spends what it needs to provide care and services, and then the federal government matches that amount. But the American Health Care Act, as passed by the House, would totally change that approach. Instead, it would establish a system where the amount of Medicaid money that a state gets would be capped, and that would be what's called a per capita cap. And so that means that the state receives a fixed or capped amount of money per beneficiary. One of the major problems with that approach is that over time, the amount of money won't change if the state experiences an economic downturn, or, as we know is going to happen, more and more of the population ages and needs long-term care, which is expensive. So the bottom line here is that caps equal cuts, and I mean massive cuts. The Congressional Budget Office, which calculates the cost of bills from Congress, has estimated that the cuts resulting from these caps would come to more than $800 billion over the next 10 years. And when you look at what that means, that's about a 26% overall cut in Medicaid funding, and that is enormous. And the impact of this would just be devastating. You know, Medicaid, as I'm sure you all know, is the largest single payer of long-term care in our nation. You know, long-term care is expensive, and Medicaid is the only way that most people can afford long-term care. So you can't have a 26% cut without having to severely limit who's eligible for Medicaid, what services people can get, and the access they can get to care. So I just want to briefly highlight some of what the impact would look like. So fewer people would receive long-term care even if they needed it. So eligibility standards would most likely be tightened, so that would make it harder to get into a nursing home, and it would make it harder to receive and to qualify for home and community-based services, and basically that puts somebody between a rock and a hard place. States would likely end up eliminating any service and coverage that they are not absolutely required by the federal government to furnish. So for instance, home and community-based services themselves are optional under Medicaid. So those could be eliminated. Things like bed hold coverage could even be eliminated. The personal needs allowance for nursing home residents could be slashed to the federally required minimum of $30, and we know that $30 per month. And we know that lots of states have give more than that, but if states are doing everything they can to cut Medicaid expenses, the P&A could be reduced to 30 and leave residents with even less money for items like clothing or haircuts than they have now. Cuts would probably lead to a reduction in provider reimbursement, which would force numerous providers to very likely fold. And with less reimbursement, it's very likely that nursing home quality of care would decline, because nursing homes would undoubtedly cut staff, and we know that that would impact the quality of care. That care would also be impacted because our survey system, the inspectors, the surveyors who go in to do the surveys in and complaint investigations in facilities, they are funded with a fair amount of federal Medicaid money. So if that money is cut, then we would probably be looking at fewer surveyors, and that would make it harder to make sure that nursing homes are adequately monitored and that there's sufficient oversight. So to sum it up, I think there's no other way to look at it except to say that the results would be dire, to say the least. So that's the bill that passed out of the House in early May, and then it went over to the Senate, where it is now. So the Senate is working on its own version of the American Health Care Act. Unfortunately, no one has any idea exactly what it looks like because the work is all behind closed doors. We know or hear that a small group of senators is meeting in secret to negotiate the details of the bill. And there are, some reports that are kind of surfacing, not concrete facts, but we're hearing that the Medicaid per capita caps, which, as I said, would cut billions of federal dollars from the Medicaid program, it looks like they will continue to be part of the bill that the Senate is working on. And I have to say that just today there was some information that's floating around that says that it's quite possible that the Senate version of the bill will make even more severe cuts in Medicaid than even the House bill. So again, we don't know exactly what this is going to look like, but we have every single reason to believe that Medicaid is going to take an enormous hit in whatever bill that the Senate comes up with. So we're not sure when voting on this bill is going to take place, but the Senate leadership is really pushing to vote on it before the July 4th recess. So we're hearing that there may be a vote next week even. So because this situation is dire and because we are possibly looking at a vote, there is a real important need to take action. So we want to look next at what all of you can do to oppose the HCA. So next slide, there we go. So that we want to take a little time to prepare you to do that and talk with you about how you can contact your senators and what you can say to them. So there are obviously lots of ways to contact your senators. You can do a face-to-face visit with them. That's at one end, and then at the other, you can simply call their office and leave a message. And because this is National Call-In Day to Save Healthcare, and the goal is to generate as many calls as possible to senators, we're going to tell you how to leave a message for your senator, and I will guarantee you that it is easy and painless. So you should all have received a handout this morning about how to leave a phone message for your senator. I'm going to walk you through it quickly, and you're going to see just how easy it is. So next slide, please. So you want to start by identifying your two senators. Many of you probably know who your senators are. If you don't know who they are, you can go to this website, which is www.govtrack.us/Congress/members. /Congress/members. And we can certainly send that that link out to you in our follow-up email. But if you go to that website, you will see this screen that you have here as part of the PowerPoint. And on the slide, there is a drop-down menu where it says, or select a state to list all senators and representatives from that state. So all you have to do is use that drop-down menu, select your state, and then as soon as you selected your state, your two senators are just going to pop up in front of you. So very easy to find out who they are. Next slide, please. So the next step is to call the Capitol switchboard, and I've given you the number, which is 202-224-3121, and I am sorry that there isn't a toll-free number, and we certainly hope that it's possible for everyone to make this call, even though it's not toll-free. One of the things to keep in mind is if we're doing this right, there will be lots of calls coming into the Capitol switchboard today. So if for some reason you can't get through when you first call, please be persistent and just keep calling until you can get through. When you do get through, you want to follow the prompts. They tell you exactly what to do, but just to make it even easier for you, let me just tell you what you're going to hear. You're going to hear something that says, "Thank you for calling the United States Capitol. To be connected to your senator's office, press or say 1. And then next, so you press or say 1, and then the next thing you're going to hear is you've reached the United States Senate. Please speak your state or enter your United States zip code." So after you do that, you're going to hear if this is correct, press or say 1. And then the very last step is to get you to one of your two senators' offices. So let's just imagine that you have senators who are called Senator Smith and Senator Jones. So you'll be told to press or say 1 for Senator Smith, or press or say 2 for Senator Jones. So once you've done that, at last, you'll finally be connected to the office of whichever senator you're trying to reach. Next slide. So at this point, when you're actually connected to the office, there are two possibilities. Either the phone will be answered by a staff person, or you may get a recording. So I made calls to my senators yesterday, and I got a recording for both of my senators. But if you listen, there is usually an option that says, press a certain, number to speak to a staff person. So there is that option. If you get a choice, so you may not have a choice, there may not be a recording, or there may only be a recording, but if you get a choice, it's up to you to decide what approach you want to take. You should just do what's most comfortable for you. It is perfectly fine to leave a voicemail message, particularly since if you try to reach a staff person, they may very well be unavailable due to the volume of calls, and you may end up having to leave a message anyway. But you can go either way. On the handout about speaking with your senators, you'll see a number of different versions of a message you can leave, and the versions just vary according to how you want to identify yourself. There are two versions for consumers, one if you're a current consumer, one a former consumer, the same thing for family members. Version 5 is for ombudsman, version 6 is for advocates in general. And of course, you can absolutely just create your own message. You don't have to, certainly don't have to use these messages that we've laid out here. If you decide to leave a recorded message, quite frankly, you can simply read out loud whatever version you choose. And that's it. You're done. Absolutely done. Painless and easy. If you happen to prefer to talk with a staff person and want to do that, you'll find that this approach is also really easy. And just to give you a quick idea of how a conversation with a staff person might go, I'm delighted to be joined by Karen Jones. And Karen has many hats. She's Executive Director and Program Manager for Long-Term Care Ombudsman Services of San Luis Obispo County, and that's a local long-term care ombudsman program in California. She's the Treasurer of the California Long-Term Care Ombudsman Association, and Executive Director, co-chair, sorry about that, Karen, co-chair of the National Association of Local Long-Term Care Ombudsmen. So Karen, you're about as involved in ombudsman-ness as I think anybody can be. So we're delighted to have you join us. And Karen and I are going to do a role play. And she is going to be a local ombudsman calling her California senator, who in this role play will be Senator Feinstein. And I'm a staff person in the senator's office. So we are now going to put on our acting hats and get started. So imagine that a phone has just rung in Senator Feinstein's office. Good afternoon, Senator Feinstein's office. Can I help you?
Good afternoon. This is Karen Jones. I'm a constituent of Senator Feinstein's from San Luis Obispo County and a local long-term care ombudsman who advocates for residents of long-term care facilities. I'd like to leave a message for the senator.
Absolutely. But before I take your message, first, would you mind giving me your name again and your address?
Sure. My name is Karen Jones, K-A-R-E-N. Last name is Jones, J-O-N-E-S. And my address is 3232 South Higuera Street. That's Suite 101B as in boy, San Luis Obispo, 93401.
Great. Okay, I've got that down. Thank you so much. Now, what's your message for the senator?
Hi. Well, I'm calling today to urge Senator Feinstein to vote against the American Health Care Act. The bill will result in devastating cuts to Medicaid. I know the senator is well aware of these issues, but I did want to lend my support to reminding her that Medicaid is the only way so many people in California can pay for their care. And the cuts would mean that Californians couldn't get the services and support they need. And again, I'm so aware of Senator Feinstein's position on this, and I greatly appreciate that. But again, I'm asking her to, reminding to please say no. These Medicaid cuts and the caps are just so devastating to folks who need long-term care in California, and of course for the rest of the country as well.
Okay, great. I've got that down, and we will certainly give that message to the senator. I want to thank you, Karen, for taking the time to call and let the senator know how you feel. I can assure you that she takes the views of her constituents very seriously. Is there anything else I can help you with today?
Yes, actually, I'd like to follow up by email with Senator Feinstein's health staff person. Would it be possible for me to get his or her name and email address?
Oh, definitely. Her staff person is Elizabeth Jenkins. That's Jenkens, and her email address is Elizabeth_Jenkins@feinstein.senate.gov. So that should do it.
Perfect. Thank you so much, and I appreciate your time today also. And if you have a moment, please thank the senator for her service. I really, really appreciate what she's doing for everybody, and I hope you have a great day.
Thank you. We will certainly convey that message to the senator, and I appreciate your taking the time to call. I hope you have a good day too. Bye-bye.
Bye-bye. Bye-bye.
So, I think you can see that that was short and sweet, and I think really painless. I think you can see that if you choose to speak to a staff person, you'll be talking with a person basically at the reception desk whose role is to take a message. They will not ask you questions about the issue. They will not engage you in a policy debate. They will not grill you. They will write down your message and thank you, period. You don't even have to get nervous. It's leaving a message. So what you do have to do, however, is make the call. So next slide, please. Okay. Let's see. I'm not sure. I think I skipped one here somewhere along the line. Oh, no, what I just wanted to add is that if you want to get fancy, you could throw a few statistics or throw a statistic if you wanted to into your message. Justice and Aging has just come up with a wonderful toolkit. You can access it by going to their website, and for each state they have some statistics that are specific to that state, like the percentage of residents on Medicaid, something that absolutely will be helpful to you. So if you want, you can add that just to beef up the message if you want, but it's perfectly fine and not to do that. Okay, now next slide. So this next part is the PEP part of the Pep Rally webinar. I just can't stress to you how important your call is today. People are saying that this vote may come down to just a few senators, so every vote is critical. And I often hear consumers and advocates too say, I'm just one person, what difference can I make? Or why should I contact my legislator? They won't listen to me, what's the point? And I know that people often feel powerless and think that their voice and their message are meaningless. Next slide, please. So I want to tell you that you absolutely can make a difference and that you have way more power than you think. Each of you are Wonder Women and Supermen. You have power right off the bat because you're constituents. Whenever I go representing Consumer Voice into the offices of members of Congress and talk about an issue, they always ask what their constituents think. They listen to constituents because constituents are the ones who voted them in, and they can vote them out just as easily. So all of us, just by virtue of being a constituent, have automatic clout just by living in the legislators' districts or state. You also have power because when one person makes a call, then another person, and then another, that adds up. Members of Congress literally count the calls they get on an issue in favor or against. And they take those calls and those numbers seriously. So your call is never pointless because it adds to the tally and sends a message. So right now we're at a point in our advocacy effort where numbers are important, and we want to flood senators' offices with just hundreds of messages about the American Health Care Act. I've asked Karen, who in many ways is a Wonder Woman, to just say a few words to help you get even more psyched up to make your two calls. Karen's been very active with systems advocacy and legislators, but I think also knows that it can feel kind of scary to folks. Karen, want to just say a few words?
Sure, thank you. So quick background, in California, when the recession hit, we lost a lot of our funding, and ombudsmen in California had to learn how to do legislative advocacy out of self-defense. We love our jobs, we want to do them. The only way to do it is to get to the legislators and tell them the value of our program. This effort is the same thing, only in a much bigger scale. We need to defend the people that we represent in care facilities, and the only way to do that is to make sure that our senators, in this case, prior it was the House, knew our stories and knew how valuable both the Ombudsman program is, but more importantly, the contributions that our clients, our residents in facilities have made to this country and how much they depend on this funding source to, help them, not suffer. I mean, the reality is if this bill passes the way it's written, there will be some very bad things that happen. So it's actually really easy to talk to legislators. They're normal human beings. They, pants one leg at a time, just like the rest of us. I don't know about the skirts, but the pants got that one figured out. So a couple of tips. One is, these calls are easy. You heard it takes 3 minutes. It doesn't go on. You don't have to be a complete subject matter expert. You don't have to have a desk full of statistics. You are a subject matter expert simply because you know that this is going to affect your clients, if you're an ombudsman, or your loved ones, if you're a family member. You're an expert. You can make this call. It's really easy. They're very nice people. They never yell at you. I would suggest, if you have the time, to get to know your local legislator staff. So your senator has people who are in your district, who are near you. Talk to them, get to know them. Those people, if you get to know them, you'll get to have that bigger, longer conversation to really explain what's going on. You can actually do a tour with them and around a facility. If you're an ombudsman, you can take them on like a ride-along so they can see firsthand what's going on with your clients and then tell that to their legislator. The other thing is, as you heard, compliment, compliment, compliment. People who get elected have big egos. That's just a fact of life. They need to hear how much you appreciate what they've done. They really want to hear that you understand that they work hard. They want to hear that you value what they've done. So use compliments. Don't be fake. They'll know, but use them as much as you can without being, uncaring about them. And the other thing is, make sure you're offering to them your resident stories. Have those stories available, so if someone does ask, again, you don't need piles of them, but you need to know that you have a woman who at 18 was a Marine serving, and she's now in her 70s, and it's a different service than they can do now, but this is someone who gave for her country, and now she's on Medi-Cal or Medicaid everywhere else in a nursing home. So it's really easy to tell our stories. We have great stories, and they need to hear them, so when they go to hearings, they can say, this is why these cuts will hurt someone. You don't want a senator making up stories or trying to scramble for statistics when you've got them. So anyway, again, it's really easy. get to know your legislators. It makes a big difference, and good luck out there. It's really fun. It's fun to make a difference.
Karen, thank you. That was absolutely spot on. Getting to know legislators, sharing the stories, not feeling like you need to be a subject matter expert. Those are all just excellent points. And I just want to add to what Karen said, is it is fun, and the best part is that you're doing everything you can to make a difference. So in looking at the time, I see that we are beyond the time when we said we would end. I see that there are some questions. We will look through those and do everything we can to respond to them and get them back out to those of you participating today. So in closing, I want to thank Karen for helping us today. Behind the scenes has been Alicia Lineswala, who is our public policy and program specialist and works with me on our policy team. So she's been helping out, so I want to thank her. And I want to thank all of you for joining us today. If we were all together and having a rally, I would now have everyone chant as a group. But since we can't do that, I hope maybe you'll just do it on your own at your end. But as corny as it is, we're going to do it from our end. So based on what's on the slide, here's our chant. No cuts, no caps, no way,
No way.
no cuts, no cut caps, no way, no cuts, no caps, no way. So take that slogan, get out there, and next slide. Use your power and call your senators just as soon as you get off this webinar, because you can do it. So thank you, and go flood the Capitol switchboard with calls to your senators. Thank you, and thank you for all that you do.